Good evening. Assalamu alaikum wa rahmatullahi wa barakatuh. I'd like to welcome you at the eighth session titled with Blockchain. It's been a two-day conference full of insights and latest advances in technologies related to computational medicine and AI. So thank you, Prof. Asma. Thank you for the organizing committee. I think it's been a fruitful discussions with my colleagues. Thanks also to the moderators and the chairpersons who have contributed to this. In this session, I hope it's going to be light. It's going to be the last for this conference, unfortunately, but we will, of course, we're going to have Dr. Majid Al-Mansouri, who will be talking about revolutionizing healthcare, blockchain's transformative impact on patient care and data management. So Dr. Majid is a physician scientist and assistant prof of clinical biochemistry department at Faculty of Medicine, King Abdulaziz University, and he's also acting as a head of blockchain applications in healthcare research unit, both at King Abdulaziz University and Oxford Uni Center of AI and Precision Medicine. Dr. Majid also studied molecular medicine and obtained both master's and PhD degrees in the field from University of Sheffield, UK. Also, his interest and insight and experience in blockchain technology impacted on his advisory and consultancy roles for national and international blockchain companies, and he led developments of projects in this area, both in medical research and emerging technologies, which allowed him to leverage skills from both domains and empower digital transformation-driven medical research. So welcome, Dr. Majid.
Thank you so much, much appreciated. Before we start, I just want to say, I want to make sure that my voice is audible and the slides are on slideshow. You can see them clearly.
Absolutely, Dr. Majid. Yes.
Yes, okay, definitely. Thank you so much for giving me the opportunity to be part of this amazing conference. And thanks to all the organizers and the attendees. As promised, this is the last session, so inshallah it will be light, as you mentioned. So let's kickstart. The title is Revolutionizing Healthcare, Blockchain's Transformative Impact on Patient Care and Data Management. There has been multiple previous initiatives that looked at blockchain as a very promising infrastructure to establish a very strong ground for transacting, also exchanging and recording patient care data. And today we're going to talk about that. We're going to talk about many of these efforts. But before we kickstart into that, let's take a very quick overview about what blockchain really is. Now, blockchain, in essence, the principles of blockchain are based on two main components. We have a decentralized network, which operates on a peer-to-peer network without having a central authority or a single entity or a single person that has full control over that network. And we also have the immutable ledger, and we really want to focus on that immutable ledger. Now, even the term immutable was not very well studied and not very well known before this so-called blockchain revolution that took place in the past decade. Immutable means that we have the ability to store data on a database that absolutely whatsoever nobody can come back to that data with a backlog, edit that data, or tamper with that data. So essentially creating a tamper-proof database, which goes hand in hand with how we want to protect and exchange patient care data and healthcare record data, which is very sensitive. On an immutable ledger within blockchain, the transactions are all grouped into blocks, which is shared across the network for increased security, and there is general consensus on the validation for each information that goes into that block. Without that verification, this data won't be uploaded and won't be having any record on the blockchain. And this concept might be familiar to all of the attendees here. But let's take that concept and keep it in mind and move on next. Now, when we talk about the blockchain network structure, what I really want to focus on is how the layers are segmented, but also incorporated all into that recipe that we call blockchain. Now, before we look at these layers, I just want to highlight something really important. In essence, blockchain as a technology is not a new technology. Blockchain is actually a mixture of multiple technologies that have been used, some of them going to more than 2 or 3 decades. Blockchain is a mixture of distributed ledger technology, or DLT, in addition to cryptographic hashing, consensus mechanisms, and some other key components such as Merkle trees and peer-to-peer networking. This recipe is called blockchain. And this blockchain network structure is composed of 5 main layers, which are essential in any kind of application built on blockchain. So let's go through them one by one. I want to start by the bottom layer, which is the data layer, which is the most important component in a blockchain, which is the data storage method on all nodes, which creates that immutable ledger or that immutable database that we want to store that data on. On top of that, there is the network layer, where the blocks are distributed and each block contains that specific data we want. If we take an example of healthcare data, those data might be a patient file creation, it might be a log of birth or a log of a death, such as a death certificate, and so on. The consensus layer on top of that is the transaction validation layer and the block creation layer, where each block gets signed and gets verified on that based on the consensus mechanism used on that network. On top of that comes the middle layer, which is the layer between the consensus and the application layer, which handles the transaction processing across the network. And the topmost layer, which is the layer that the patient or the person interacts with, which is the application layer, which uses interfaces built on top of smart contracts. This is the initial anatomy, as we call, for all blockchain network applications and all the structure of all the applications that are built on blockchain, whether they were decentralized applications, other centralized applications, or whatsoever. Now, I want to go back to the 5th layer, which is the most important one. If this 5th layer or the data layer is not validated and does not carry an application layer on an immutable database and does not copy that data on an immutable database, then we cannot call this application a blockchain-based application. And there has been multiple applications that we saw which have data layers that could be edited later on. This is not a blockchain-based product or a blockchain-based application without having a secure, immutable data layer. Now, the blockchain transaction process starts, as we all know, with a transaction initiation, going to validation, mining and consensus, to block confirmation, to ledger update. Now, when we understand that concept, we can see that this concept can be applied at multiple industries, as we've seen. And in the past few years, there has been lots of blockchain real use cases in multiple fields. We want to focus on the patient data and the healthcare data and how this creates a perfect recipe to really build and the potential of building and registering all patient and healthcare data on blockchain. Now, this takes us to the most important part of today's talk, which is how can blockchain help in healthcare data management? Before we answer that question, let's take a step back and look at the complexity really of healthcare data and why healthcare data is one of the most sensitive, most complicated files, even with multiple countries. We've seen that they have struggled to really find that, let's say, ideal method or perfect method to store and exchange patient data. And today, even when we look at the systems and the healthcare systems that are across different countries, we can see that each country has its own method of collecting healthcare data, storing that data, and exchanging it with other service providers or other medical insurance companies. Now, the study of KSU and Van Mathy 2024, which I have the reference to at the end, which you can take a look at, really summarized some of these healthcare data management regulations and laws, and in particular, the most famous ones. So if we take a look at some of the most famous regulations or laws of healthcare data management, we can see that India in the year 2000, introduced the Digital Personal Protection Bill, which has been revised several times, and the last revision of it was in August 2023, and it's one of the widely most used regulations of patient and healthcare data protection. In the States, for example, we all might have heard about the HIPAA, which is the Health Insurance Portability and Accountability Act in 1996. It was introduced for the first time, and in 2009, it was also introduced as an extension to the HIPAA, which they called the high-tech. And now there has been multiple also news that maybe with the new Trump administration, there will be a completely new healthcare data regulation or law, which is built on the HIPAA, but might introduce different horizons of that data care management. European Union in 2016, around the time of the Brexit, has also introduced the General Data Protection, or the GDPR, which is known to anybody who worked in the European Union. In Canada, they have the PIPEDA, which has been introduced in the year 2000, which is Protection and Electronic Documents Act. These guidelines for this PIPEDA Act was for the privacy, utilization, and availability of individual information. In Australia introduced something interesting, which is called My Health Records Act, which has been introduced in the year 2000, which focused on ensuring patient ownership of their health records, which is a point that multiple different acts did not take into consideration. Now, those are the different healthcare data management regulations and laws by multiple other countries. And let me highlight something very important here. Why are we even mentioning this? Despite the extensive framework that different countries, laws, and regulations have provided, as we can see in the table in front of us, for protecting the personal information, there is still a major problem. And due to the sensitive nature of healthcare information, unfortunately, there is severely high demand for it on the dark web. And what many people don't possibly know is that, unfortunately, the healthcare data is one of the most expensive data in the dark web. And the attackers are willing to pay a very high price for it. And those information can be very simple, such as names, ages, addresses, file numbers, bank account numbers, and other private information that can be collected from healthcare applications, institutions, and even simple clinics. And because of this, the primary objective of the healthcare industry is to create a plan that is both effective and efficient for ensuring that data is kept secure while being interoperable with other systems. And this is why we've seen multiple efforts of that. And this is where comes the promise, or the future promise, of creating a blockchain-powered infrastructure that allows all these three elements and solves all these different gaps that we've seen in the previous healthcare data acts. The secure and interoperable health exchange, which we have seen as a model in multiple studies, stores the data on blockchain, allowing the secure data storage, leverages the interoperability of the distributed ledger and the backend of that blockchain, and at the same time, it gives the patient-centric control, which is the attribute that you cannot get except with building the blockchain and creating the infrastructure for the healthcare systems on a blockchain, where the patient can have the opportunity to own his data and manage and control the access of their own medical records using a blockchain-based identity or any kind of blockchain-based consent mechanism. I want to really highlight that there has been multiple studies, multiple researches, and the potential and the promise of integrating the blockchain infrastructure of healthcare systems has been really huge, and the studies are limitless. And as we can see here, this diagram on the right summarizes the blockchain in healthcare use cases, and I want to really take it from an academic research perspective. So there has been 3,800 Scopus records on publications related to blockchain in healthcare as of September 2023. Only. So we're talking about less than 2 years. We have 1,383 IEE accesses about papers on blockchain applications in healthcare, and 537 on PubMed, which is focusing on blockchain in medical contexts generally. Now, what's rather interesting is that if we take a look, we will see the light blue color, which is 76% in Scopus, 55% in IEE, and 42% on PubMed. Those are all within the data management and the promise of blockchain being a very promising tool for healthcare data management. We can see that blockchain has been also conceptualized and has been used as a proof of concept and some other real-world use cases in clinical trials and supply chain management for pharmaceuticals and medical supplies, also in medical insurance, in telemedicine, and also in other medical use cases. But even the research can really highlight that the highest potential here is for data management, and why blockchain really is, I don't want to say perfect and I don't want to sound biased, but it serves as an excellent tool to solve that gap of the problems that are happening in the healthcare data management systems. The protection of patient privacy and data ownership also serves a great promise with blockchain, where we can secure that data on the blockchain, which gives the data security, which is not comparable with any other systems. It gives the patient control, and it also is very easy to implement regulatory compliance based on blockchain-based healthcare storage systems. Also, EHR management with blockchain is a very promising tool which has been studied in multiple studies, and we've seen it where it allows the secure data storage, the patient control, the integrity of the data, and it leverages the interoperability and the ability of exchanging that data across different other systems, even if it was in a different country, if all those systems are connected to the same blockchain infrastructure, which is one of the biggest problems that happens to patients or individuals who travel a lot and find that problem of not having the same data on the same database and having the issue and the hassle of the consequences of that in their healthcare journey. EHR management frameworks and some of the examples that have been highlighted. I don't want to take more into that. I'll keep some time for the questions, but Hyperledger Fabric with Sharma et al., and I have that reference at the end if you want to take a look at that study, developed a framework for basic electronic healthcare record management features. One of the most famous examples on the Ethereum network was the KSU et al. Paper and the study of them, which they created a platform using smart contracts for data authenticity. This one was really, really promising. There is also the Federated Blockchain Project by Omar et al., which proposed a system for storing and sharing private medical records. And finally, the famous example of Amazon Web Services integration, where the researchers developed a HIPAA-compliant framework for cancer patients, and it was 100% HIPAA-compliant, and it was a very successful one in the United States. I personally had multiple experiences. In 2018, I worked with a company called Solister Health, where we proposed and created a system for narcotics management and track and trace solution built on blockchain. We leveraged a blockchain called GoChain, which uses a consensus mechanism that has been introduced at that time in 2018, around 7 years ago. It was called, the consensus mechanism was called proof of reputation. Which validates data based on and leveraging that consensus mechanism. And this collaboration of the narcotic track and trace solution was done with a pharmacy in Nashville, Tennessee called Good Shepherd Pharmacy. I can tell you more about it and answer answer any questions you have at the end. So in the end, if you want to summarize, the transparency and traceability that blockchain gives can be applied across healthcare systems, and it serves as a very, very high potential tool also in clinical trials, where we can have everything on the same database, from patient consent to data integrity and supply chain tracking. One of the biggest fields of healthcare and medicine that acquired a lot of the attention of blockchain developers and blockchain integrations with the supply chain management, as I mentioned, in particular in the narcotics and the sensitive medications that need to have a very high authenticity and high traceability and transparency layer to track and trace their movement. And of course, as we know, to solve the gap of having these medications in the black market, as we have seen with multiple different countries and multiple examples. Which is the blockchain and drug and traceability element that I just spoke about. And this concept basically starts with having unique identifiers for each medicine package. And you can secure and upload all the data securely on that blockchain, which allows even going back with the backlog and tracing all those medications from the factory when they were first introduced up until the patient's file, which claimed those medications. which solves a big problem that healthcare providers and people who work in healthcare know exactly what I'm talking about. There is also multiple other examples of use cases in the insurance claims and the medical insurance. For the sake of time, I won't be going into that. And as I mentioned, combating the counterfeit drugs and medical devices use cases. There has been multiple studies that looked at integrating IoT with blockchain in medical device tracking, where the device creation also has an initial of the manufacturing details, maintenance, and ownership transfers, and also collecting the information from these devices can be stored on blockchain as well. Multiple examples of that. I've left references. You can look at these and some of these studies. At the end, I really want to close by this statement. The future of blockchain in healthcare is very promising, in particular, the future of blockchain in healthcare data. And as we can see now, there is a lot of AI and machine learning integration. And really, when we look at it, AI and machine learning is all built on feeding those machines with data and feeding these machines with information. And unfortunately, these information cannot be always guaranteed to be correct. If we go into some of these GPTs also and feed them wrong information, this wrong information after a while will be correct information based on that AI. So really, this is where I think blockchain and AI come into an excellent integration. Blockchain is all about providing authentic, verified data, and AI is all about exchanging, extracting, and pulling data based on prompts, if we take the GPTs as an example. And here comes this integration where blockchain can be the tool to verify that data, which we can be using later on at multiple other technologies. So really the future of blockchain being the authenticity method for data in healthcare and across other sectors is very, very promising. And thank you very much. And I'm happy to take any questions. Thank you very much.
Thank you, Dr. Majid. That was really interesting, as in terms of blockchain and their applications. This is really entertaining. Thank you for your insights and for the shared info. I like actually the last few words as well as the first ones as a method to verify and affirm authentic data. That is really interesting. And to pulling data as an AI function. I wonder, Doctor, in the meantime, maybe we will have quite a few questions. We will be flexing with time until 4:25. So if we are having some questions from audience, we will be happy to receive those. In the meantime, I wonder, Doctor, how do you see the field of blockchain, let's say in 5 years, within the context of KSA or the GCC or the MENA? So with relevance to value-based healthcare and these trends in healthcare where we want to save money and provide effective healthcare. How do you see that?
Yeah, absolutely. Definitely. Amazing question. Let me start by telling you, when we speak about blockchain, we speak about a 17-year-old technology. A technology that was first introduced in 2008 with examples of use cases up until 2013, all in the financial industry. In 2014, with the introduction of Ethereum and the new concept of smart contracts, people started to realize that there is much more potential to be used in multiple other fields, in addition to the financial side, the financial industry, the financial sector, and the cryptocurrency side of things. And here, this is where many people get really confused. If we mark the blockchain field and their use cases in real world use cases such as data management, by the year 2014, which is the year where smart contracts were introduced, then we're talking about a 10-year-old technology. And this is not enough to really predict the extremely high potential of how it can be part of our life. So essentially, we are in the time where, similar to the times where the internet or the World Wide Web technology was 10 years old. Many people we're predicting that it can be used across multiple industries, and there was mixed emotions, there was fear, and there was multiple predictions of how it can be used and integrated across our lives. And here we are, we're doing this conference leveraging the World Wide Web and leveraging many technologies. So what I really want to highlight here is that it's a very early technology. It's a very promising technology, and it really redefined our understanding of what authenticity and verification of data is. If you look at even big industries, big ministries, even the biggest companies in the world, their data is at risk. And their data is centralized and stored on centralized systems where somebody can go in and change even data that goes back to 30 years or 25 years ago. In blockchain, that is not possible. You cannot edit any data once that data is verified. So it really changed our concept of how data can be protected. And if you take that and apply it across all different fields, I mean, there isn't any single field where data is not essential for them. So I think this gives us some understanding about how important really blockchain is. I don't think that blockchain is a technology that will come and potentially replace some of the technologies, but I truly believe that blockchain will become an essential technology that will integrate current systems and would add further security and authenticity to the data we share across these systems.
Definitely, Dr. Majid. Well, you mentioned, you touched actually the cybersecurity aspects of that. So I wonder, Dr. Majid, if there is like how to, since we have colleagues from academia, from industry,
Yeah.
like how to maintain the cybersecurity. I know the concerns about, the privacy and maintaining the integrity and blockchain as a validation tool for the info. So we want to make sure that our validation method or approach is really working. How can we imply that in practice? Like if there's how to or checklist perhaps, or
Of course.
there's specific
Of
bold.
course. Now, again, because the blockchain systems and the blockchain applications are fairly new, the examples we have seen of, let's say, let's stick with the same example of healthcare data management. The examples we have seen with healthcare data management are all in the POC stage, proof of concept stage. Nothing has been pushed into production, and nothing is used as let's say, a de facto method of collecting data. And the same goes across all the different fields that used blockchain in supply chain management and so on and so forth. And as we speak, there is multiple developments happening on how to ensure that these systems can be used efficiently, and there are no cybersecurity breaches or anything like that. And in essence, we have two main types of blockchain, because you mentioned also security and transparency, which is a very important point. We have private blockchains, we have public blockchains, and we have what we call a consortium, which is a mix between private and public. The misconception that happened is that public blockchain cannot be used in any field, and some of the data are not supposed to be pushed to public. In particular, when we talk about civil data or data such as the data for Ministry of Interior or data for even healthcare data and some aspect of that healthcare data, a public blockchain might not be the suitable kind of blockchain to use for such sensitive data. And here comes the other kind of blockchains, which is the private blockchains, which is more suitable for enterprise or governmental use cases. And each of these have their own cybersecurity assessment in between private and public blockchains. And I think if we take a look at the examples that we've seen from different countries and their efforts into integrating these systems, we can see that these systems have a very strong infrastructure of authenticity and verification of the data. But the question always comes in cybersecurity concerns when you attach an application on that blockchain. And this is, I think, one of the most challenging areas that is being developed yet as we speak.
Absolutely, Dr. Majid.
Question.
Thank you, Dr. Majid. I think we have any questions, but also have another one. Apologies for
Please,
that, Dr. Majid.
please, with pleasure, with pleasure.
We're actually, thank you, Dr. Majid. We were actually discussing the during the SADAIA's
Yeah,
talks in our KSUMC within the medical city. We had some workshops, and we have been covering the Saudi personal information laws introduced, I think, the year before last year in 2022.
yeah,
And I think that there will be implications with that law on what we are doing in healthcare and of course with relevance to blockchain. So, I mean, how do we make sure that we are implementing these laws within our, let's say, end user? So, as a clinician practicing in my clinic, how can I maintain and make sure that I am in line with that law and I am contributing to the bigger picture of validation approach by blockchain from the other end. So I was wondering, like, what clinicians, because we have also clinicians in the room, so what
mm,
clinicians can do from their side to make sure that they are sticking to these guidelines, and then I'm sure that within each country there will be an umbrella with for such guidelines and laws.
yeah. يعطيك العافية Dr. Abdullah. Very, very good point. And I really want to touch base on something you mentioned, which is the usage, because we all know that as much as we use a blockchain, as much as it gets more validated, and as much as we feed a certain blockchain data, as much as it becomes more secure. And I think one of the things that we can really say here is that there is a big gap and there's big room for really a governmental entity or even a startup to come and introduce a local blockchain-based healthcare data system and experiment that. Alhamdulillah, and we have large entities here providing healthcare across even some of the smaller cities in some of the faraway areas from main cities in the kingdom. And I think with the number of the population we have currently in Saudi, and also the ratio of doctors to population here in Saudi, I think we in Saudi Arabia are. We set a perfect example of a country that can really produce an excellent example of a cohort or a study utilizing blockchain based healthcare data exchanges and healthcare data systems. And I really want to take the opportunity really to say that I'm more than happy to start that with whoever wants from the attendees in the room and with the help of the organizers of this virtual conference. I think this is an excellent opportunity for us to start that. There is really no data for that whatsoever based on my knowledge here in Saudi. And I think you raised an excellent question, which can be transformed into a large national scale POC or potentially even maybe a startup to take that question and find the answer, because unless we start and doing it, we start and do it, we cannot reach an answer.
Absolutely. Absolutely. That was clear, and thank you, Dr. Majid.
You're most welcome.
We have also Prof. Asma. She had
Yes.
and Dr. Fatima. Please
I saw a
go.
few hands raised. Yeah, I think Dr. Fatma and Prof. Asma, yes, with pleasure.
تفضلي دكتورة فاطمة. I see Dr. Fatma has lowered her hand. You can take
questions.
you can Dr. Abdullah, there's a question in the Q&A box. You can start with him.
Absolutely. We have Dr. Majid, a question from Dr. Ibrahim Al-Sani, who's an oral histopathologist at KSU. Do you think the approval of blockchains in financial sector worldwide will facilitate the usage of
Excellent question. Excellent question. Dr. Ibrahim, I would like to thank you for that question. It's an excellent question. So let's go back to the history of blockchain. As I said, when blockchain first emerged, it was mainly for the financial sector and the financial side of things. And I'll share with you one of the information that many people probably don't know, but Saudi Arabia was one of the leading countries worldwide into experimenting blockchain in the financial use cases, even before some of the biggest countries, which are considered blockchain hubs or blockchain countries. In 2018, Saudi Arabia, alongside with the government of UAE, released a project called the Haber, which is a project that introduced blockchain-based cryptocurrency for the settlement of trades between Saudi Arabia and UAE to avoid foreign exchange between dirham to riyal, which had potential to save billions of riyals between both countries. However, everybody knows that there has been no shortage of controversy around the let's say the bad uses of cryptocurrencies or the consequences of using cryptocurrencies. Everybody knows, and if you do a very simple Google search, you will see that cryptocurrencies are unfortunately and has been unfortunately associated with a lot of illegal monetary activities, in particular in the early days between the years 2013 up until 2018 and 19. Which unfortunately really blurs the big picture of that blockchain infrastructure that can be utilized in some of the very promising use cases. Right now, for example, in Saudi Arabia, the last rules and regulations from SAMA, which is the Saudi central bank, are that cryptocurrencies are extremely prohibited. It's a red line. I personally was the lead blockchain consultant alongside with my partner Mohammed Ramadan. We were the lead blockchain consultants on the national CBDC project, the Central Bank Digital Currency Project, which has been done by the Saudi Central Bank and Saudi Payments. And we can see that regulation is a big obstacle into pushing blockchain-based solutions mainstream, in particular in the financial side of things. Now, back to your question, Dr. Ibrahim. We've seen this pattern in all countries. Because the majority and the major use case of a blockchain is within the financial industry. And if you take a look at the cryptocurrency market or the decentralized finance market of blockchain, you're talking about a multi-trillion-dollar market right now. Because of that, regulation has always often been associated with regulating that use case to begin with, which is the financial side of things of blockchain, i.e. cryptocurrencies and the related sectors such as DeFi and the others. And we have seen a lot of resistance from countries to look into the regulation of blockchain in other use cases until they regulate the financial use case. However, in Saudi Arabia, that is not the case. The Saudi Commission of Space and Technology, CST, as well as MCIT, وزارة الاتصالات وتقنية المعلومات, all of them have completely took into consideration that we don't want to take a look at the blockchain use cases in finance right now. This is custody of SAMA, malna salah fiha, but we want to look at the other use cases of smart contracts. And there has been a lot of promising news in the past 3 and 4 years. For example, وزارة العدل, Ministry of Justice, have taken big initiative into regulating the smart contract, which is the contract based on blockchain. وزارة الاتصالات وتقنية المعلومات, as well as CST, Commission of Space and Technology, have introduced a legal framework to use blockchain in applications. I was part of reviewing that mandate as well, alongside with my partners at Chain Advisory. And there has been multiple use cases of blockchain in real estate and multiple different other use cases. And I think with these POCs and with these proof of concepts and the fruition that might come from them, we can come up with a regulatory framework for these use cases away from the financial side of things in blockchain. Thanks again for the question, Dr. Ibrahim. يعطيك العافية.
Many thanks, Dr. Majid. We can't get enough, actually. We have been discussing for 40 minutes, but it was like a few minutes. Thank you so much, Dr. Majid. We appreciate your time and then the valued insights that you have crossed during the talk. Thank you for your time. We much appreciate it.
Dr. Abdullah, يعطيك العافية. Thank you so much. And many thanks to Prof. Asma as well for the amazing efforts and the organization of this virtual conference. Thanks a lot for the attendees. It has been my pleasure. Unfortunately, the time is small. The topic is really big, so I really hope I covered as much as I can. And I'm happy for my email to be shared with the attendees if there are any questions or any more knowledge that we can share and exchange. I want to say that I've really learned a lot from the conference and from the questions and from the attendees, and this has been very, very valuable. Thank you so much. Much appreciated.
Absolutely. I think we're going to have some more talks in the breakout sessions as well. So
Yes,
we're not going to be away. Thank you, Dr. Majid. And now we will have the session with Dr. Mona Al-Shardan, who's going to co-chair the next talk.
Thank you, Dr. Abdullah, and thank you, Dr. Majid, for this informative and comprehensive talk. It's really inspiring. It inspires me personally on how blockchain and healthcare are converging. Thank you very much. We also will proceed with another contributor to this session and welcome Dr. Abir Al-Hamidi for his talk about blockchain-based system for prescribing higher or high-risk drugs. Dr. Abir is a professional in the fields of Web3 and blockchain. She's the founder of the Blockchain and Web3 Lab at King Saud University. Dr. Abir also is a certified blockchain-oriented blockchain developer and architect, as well as a certified cloud leader and architect, and certified machine learning developer. Currently, Dr. Abir is an academic and the Vice Dean of Development and Quality at the College of Computer and Information Science at King Saud University. In addition to her role at KSU, Dr. Abir serves as the CEO of iSpeak Tech, where she promotes digital transformation and technology literacy in Saudi Arabia's public and private sectors. Dr. Abir's commitment to ethical technology use and community impact is reflected in her volunteer work with Tawasul, an organization focused on assistive technologies. She also involved in as a technical advisor committee at MESC Innovation D1. Dr. Abir academic credentials include a PhD in cloud computing from King's College London and an executive certificate in digital business, blockchain and AI from MIT Sloan School of Management. Welcome, Dr. Abir, and the mic is yours.
Thank you, Dr. Mona. Thank you very much for all the people here in the panel. Thank you very much. I appreciate that you're still late for this session. I will present in this talk. I will try to present in this talk how we secure our effort to securing the patient and enhancing the patient safety by providing and by suggesting and implementing a blockchain-based system for prescribing high-risk drugs. I will try to cover as much as I can. However, for the sake of sake of time, I divided the presentation of this talk to three main parts. The introduction, where will I describe what's the problem. Then I will describe the solution that we come up with it. Then when I will briefly highlight the evaluation that we did it for the solution. So I will start with the first one. So in the pharmaceutical supply chain, there is several problems ensuring that the medicine will arrive from the manufacturer to the patient in a secure way. So these problems include that the medicine required a specific transport condition to preserve their efficiency. It's also need to enhance the traceability of the drugs to avoid the drugs counterfeiting. Also, improving the process of prescribing and deliver medication in general to avoid problems like overprescriptions. For the first two problems, like for example, a specific transport condition or a traceability, several solution has been provided in the system in the market now, which also rely on the blockchain technology to solve these problems. So solutions like block pharma, like modem, like medical ledger, like Teron, all of them, they all used in the global market to ship the medicine in a specific way and to deliver it to the country, the designated country, in a safe in the safe conditions. However, when this medicine received in the country, or like in the Ministry of Health or in the hospitals, there is no way in that there is some solutions. However, there is no market in the market. There is no um, a valid, reliable solution to avoid the problems like overprescription that can come with the process of prescription and dispensing the medicines. So, and this has been highlighted in a global research findings, and also in local, and it has been acknowledged even in a local studies where they acknowledge that there is a problem comes from over prescriptions for medicine. So what we did, we first tried to investigate the current solution, especially in Saudi Arabia. I would like to highlight that we did the investigation in 2023. So anything comes in 2024, please inform me if it's not valid, if the information that I'm providing is not really valid for the 2024. And we review several pharmacologists. We also surveys different patients, not specifically patients who received a high-risk drugs, but in general, we took the opinion of the society about the new system. So we investigated that there is three problems. The first problem, a double prescription. So because there is no underlying network connecting the public sector and the private sector, and even in the public sector, there is a different segmentation of information. There is no one single point of information. A patient can manipulate the system and go to two different hospitals in the same time, like for example, in a very short time, and has different prescriptions for high risk dosage, and this dosage will be recorded in his record in the database that related to the record related to this hospital. The second problem is double dispensing. So if the patient as well can manipulate the system, like for example, by counterfeiting the prescription and use it in different pharmacies, because the update of the dispensing is not happening in the real time. The third problem that we found it is the verification cost. If any incidents happen, and this is highlighted by the pharmacologists that we reviewed, that any incidents happen, especially the people the people who is related to the ministry, it's costing time and effort, because it needs a committee, special committee to investigate, to review the data and to get the information out from the sources and to compare them. So the verification for this information is costly. So because of these three problems, we suggested to have a blockchain-based system to solve this problem. For the sake of time, as I mentioned before, I will assume that you know that blockchain technology, and I will try to explain how we use the blockchain technology to implement our system. First of all, we suggested the solution to be blockchain system because of the features of the technology, like the transparency, the real time, the costless net verification, the costless network operation, the distribution, the decentralization, the security, the encryption. So there is multiple features in the blockchain which make it very suitable for the solutions. We suggested in the solution to have 4 stakeholders: وزارة الصحة, Ministry of Health. We suggested also to have the hospitals with different kind of wallets in the system. We suggested to have pharmacies as well as a different with a different role in the system, and we have also the patients. So how we designed the system? We designed the system to be a private permissioned network. What does that mean? Private, it means owned by Ministry of Health. If it's a blockchain, it doesn't mean that it should be a public network. It doesn't mean that it should be owned by different entities. It can be owned by one entity, which is here, the public, the Ministry of Health. However, this solution can be altered very easily to have a consortium. Consortium, it means that owned by different entities, limited, the different entities. Like, for example, if we want these data to be owned by different hospitals instead of the Ministry of Health. For example, all مجلس مركز المعلومات الصحي أو anything like this. So we assumed that it's a private permissioned network. It means that only the permissioned entities can participate in the network. It's not like the Bitcoin, it's not like the Ethereum that everybody can join the network. Only the approved entities that they can join the network. I know that there is some misunderstanding about the blockchain and its capabilities, assuming that it's always public, it's always distributed and globally. However, there is some capabilities that allowing us to use the features of the blockchain, however, to limit them to be private and permissioned network. In this solution, we suggested first to have وزارة الصحة or Ministry of Health to be the owner. Her role to be the owner, or its role to be the owner. What's the responsibility of the owner? One, وزارة الصحة can accept registration requests from hospitals and pharmacies. So an online application will be provided with the specific information. We suggested that we need couple of data. However, this can be altered very easily in the system to require more information. Also, one of the people who or user participated in the experiment of this system, they suggested to have an option for investigating visits. Like, for example, وزارة الصحة, when they received an application from hospital or pharmacy to join the network, to have an option to assign an investigation visit to one employee, so this employee can go and visit the hospital and upload his review. However, we didn't implement this part, but we will consider it in future work. Also, the ministry is the one who responsible about registering patients. Any patient will only be registered by وزارة الصحة or approved the registration. I will explain the process of registration later.
Dr. Abir, sorry,
Yeah.
can you please make the slides full screen? We still, it would be better orientation if it's full screen.
For me, it's full screen. Let me check. Sorry.
We still see the other side. That's the next slides coming.
Okay, so I'm presenting the screen 1, not screen 2. Sorry.
Yes.
Thank you for letting me know.
That's
Okay.
fine. Yeah. Thank you very much.
So وزارة الصحة, as I said, they will also determine the list of high-risk drugs. So easily they can maintain this list by adding more items, deleting more items, and to monitor this list, and it will be reflected in all the system. Also in the system, we provide a dashboards for the Ministry of Health to have a 360 dashboards about the state of the high-risk drugs in Saudi Arabia. To the far of my knowledge, that this information not available now in Saudi Arabia. So using this network, if it's adopted by the Ministry of Health, they will have a dashboard, a 360 dashboard about the state of the high risk in Saudi Arabia. The last option that we provided for the Wizarat al-Sahha is they can review information for all hospitals, pharmacies, patients. They can see all the transactions, who buy from whom, what hospital prescribe for what, and they can track any transactions available in the network. This is for Wizarat al-Sahha. For the second stakeholder, which is the prescribers, the hospitals. So what the kind of features available in the system, they can request to join the network. Okay, and this will be approved by Ministry of Health. If they approved to be part of the network, they can do the rest of the things. They can see the patient information in the network, so they can review if he gets a dosage from different places, if he prescribed another kind of drugs, and they can evaluate the medical state of the patient. Also, they can prescribe a dosage from the high risk because they approved as a party that they can do the prescription. They can prescribe a dosage from the high risk drugs list and update the patient record in the system immediately. So the update will be reflected in the network directly. Also, if the patient exists, if the patient not exist, then the request to create the patient record will be sent to the Ministry of Health along for approval, along with the prescription. So it will be double transaction, but will be pending until it being approved from the Ministry of Health. However, if it's already the patient has a record, then no need for the approval from Ministry of Health for each prescription, because they approved the hospital. They don't really need to approve each prescription. However, if it's a new patient, they need to be approved from the Ministry of Health before and registered in the network before updating his record by the new prescriptions. The third stakeholder exists in the system that we suggested is the pharmacies. So now the pharmacies can registered online, and we consider them as the dispensers. They can request to join the network online with the providing, as I said in the case of the hospital, by providing information. We suggested in the system to be couple of data. However, this can be altered very easily. And as I said before, that some of the people who participated in the experiment result of the system, he suggested to have a review or investigating visits to the pharmacies as well. So they should reveal any inventory they have from a high risk drugs, and they should upload and update their inventory record in the network. So in the network we have the balance of the users, and we have also the inventory of the pharmacies as the main source of data inside the network. They can display their inventory online in the DAB marketplace, and we have now as a consolidated a place where all the pharmacies who eligible to dispense a high risk drugs, they can use this DAB. So you don't really need to go the specific pharmacy website and upload the prescription, or go directly to there, or go to the hospital. You can use the DAB directly as a one consolidated marketplace. Also, the pharmacies enable registered patient to purchase medications in accordance with the prescribed dosage. So according to your balance, I mean the patient, according to their balance, they can purchase all or part of the dosage required for them, and they can purchase from one or different pharmacies according to their to the inventory that is there. However, the main condition there to not exceed the prescribed dosage for him or her. The last stakeholder we have in the solution is the patient. So for the patient, we refer to them as the customer in the market, in the distributed application. So we have users should log in using their credential, which is the unique number in the wallet. For each user in the blockchain, there is a wallet, and the wallet has a private number and a public number, and they should sign in using their private number. In addition to the private number, there is a biometric measure that should be taken for the user. So we use the face recognition to ensure that the person who used the interface of the patient in the DApp to be the patient himself, because we use the biometric verification in addition to the credential verification. This ensures that the customer is the patient himself. I would like also to highlight in the case of pharmacy, in the case of hospitals, we suggested that each pharmacy and each hospital has only one account to update the network. So, for example, in hospitals, we assume, and this is what we see in the practice in the hospitals, that, for example, if a high risk, if a drug considered as a high risk being prescribed to a patient, this prescriptions should be approved from another entity, another person inside the hospital. So we assumed that the last person to approve this prescription in the hospital, they will upload it to the network. So we don't really goes in the procedures inside the hospitals, because in some hospitals they have only 3 layers of approval. Some hospitals they have only designated doctors to prescribe. So different procedures from different hospital to ensure the correctness of the dosage for high-risk drugs. However, we didn't in the solution goes that far and entered to these procedures, and we assume that each hospital and each pharmacy has only one account. However, in the future work, we suggested to have a one process to be followed in all hospitals and all pharmacies to ensure the approval and the correctness of approval and the sequence of approval for each transactions. However, for the current system, we have only one account for them. So coming back to the customers, as I said, we ensure that the customer is the patient himself by using the biometric verification. So the user or the customer can review the inventories that already in the marketplace in the D app and can suggest what kind and from which pharmacy he wants to buy and what the percentage of his dosage he would like to buy, like 100 like for 100% from the dosage or only 50%, and this is also depend on the inventory that exists in the system. So the user can review and after that can buy all or part of the dosage from one or multiple pharmacies. The user also can review his data and the history of his data at his transactions. And request to change if there is something which is not correct. Not in the transaction done automatically. However, if there is something wrong in his information.
Dr. Abir, sorry to interrupt, but we have to wrap up.
Yes.
It's almost time.
Yeah, it's only 2 slides and I will finish. So we did implement this system, and this is a glimpse of this system. I will not go directly to that, but as you can see, this is the interface of the applicant of the patients. What's the advantages here? That you have a dashboard for the inventory in the Saudi Arabia. You have an online consolidated online mark. You have a real-time updates in the network. It's a costless verification, as I explained. If there is an incident, you just go and review the transactions in the blockchain. You don't really need to commit a committee and conduct a committee and go to different places with different data. Timeless registration, verified prescription. This is important. So if a prescription has been uploaded to the record of the patient, because there is a hash related to it, it cannot be counterfeited in the system. One of the disadvantages that we found it when we do the experiment on the system, that the implemented system not easy to use. However, the system it can be enhanced. So they suggested to enhance the user interface and also the cost of implementation, because the expert in the development and implementing blockchain, it's not that much in even Saudi Arabia, especially in Saudi Arabia. So the cost of implementation, it's a little bit higher than the normal systems. Thank you very much. I think I should conclude now. Thank you very much for your listening and for your present. And I will be available in the breakout session after that. However, if there are time for a couple of questions, I will be available.
Thank you, Dr. Abir, for sharing this impressive work on blockchain. Thank you, everyone, for listening. Dr. Abdullah, would you like to conclude? I think we are going to the breakout rooms for networking and questions and answers.
Okay, thank you, Dr. Abir, for this interesting and clear presentation. You've made the technical aspects of blockchain easy enough, even for us medical professionals to understand. So,
thank you, Professor Asma. Thank you for the invitation.
فختامها مسك ما شاء الله تبارك الله. So we will now go to the breakout rooms to allow the audience to interact with Dr. Majid and Dr. Abir. And when the breakout rooms close, that will be the end of our symposium. So before we go, on behalf of the chairman of the Department of Oral Medicine and Diagnostic Sciences, and on behalf of the organizing committee, I would like to thank all of our esteemed speakers and panelists for sharing their valuable time and knowledge and expertise, and giving us a very informative and enjoyable 2 days during this symposium. We also thank all the session chairs and breakout room moderators for their efforts. And we thank the audience for their interest and enhancing this symposium with their questions and comments and discussions, whether in the main symposium room or in the breakout rooms. We hope the audience and the speakers have benefited from meeting each other, and we look forward to hosting you again next year. Assalamu alaikum jami'an.